Do you sometimes feel like your throat is super sore and your skin looks like a sunburn with tiny red bumps? Imagine your tongue turning red and bumpy, like a strawberry. That might not just be a bad sore throat, it could be scarlet fever. It's a sickness that mostly affects kids, but adults can get it too. It's linked to a bad sore throat and a rash that spreads fast. Have you ever had a fever with a rash and thought it was just allergies? It might have been something more, and now's the time to understand it better. So what actually causes scarlet fever? Let us play detective. Think of germs as tiny invisible bugs. One germ called Group A streptococcus, or Strep A for short, is the main troublemaker. You may have heard of strep throat. Well, scarlet fever is like strep throat's cousin that brings a rash to the party. When this germ infects your throat, it releases a toxin, a kind of poison that causes the red rash and red tongue. How does it spread? Through sneezes, coughs, or even sharing a water bottle. So if your friend had strep, and now you're feeling rough, guess what? You might have caught the same bug. Let us check your symptoms. Is your throat red and painful, making it hard to swallow? Do you have a fever above 101 degrees Fahrenheit, 38.3 degrees Celsius? Now look at your skin. Is there a rough, red rash that starts on your chest and tummy and spreads? If you press on the rash with your finger, does it turn white for a second? That is a clue. Also, is your tongue bright red with bumpy spots, like a strawberry or raspberry? Other signs: swollen neck glands, nausea, and a weird white coating on your tongue that peels off. If you're ticking 3 or more of these boxes, scarlet fever is a strong possibility. How do doctors find out if it's scarlet fever? First, they'll ask, when did you feel sick? Do you know anyone with strep? Then they'll use a tiny swab to check your throat, just a quick rub at the back of your mouth. That's a rapid strep test. If positive, you've got strep and likely scarlet fever. Sometimes they send the swab to a lab for extra checking. Treatment easy. Doctors give antibiotics like penicillin or amoxicillin for about 10 days. After 24 hours on meds, you're no longer contagious. So you can go back to school or work. Important, finish all your medicine, even if you feel great, so the germs don't come back stronger. Can scarlet fever be avoided? Yes, with simple habits. Imagine your hands as germ magnets. Washing them with soap and water for 20 seconds, that's happy birthday twice, helps remove stealthy germs. Don't share toothbrushes, cups, or utensils. If someone in your house has strep, keep their towels separate. Cover your mouth when you cough. Use your elbow, not your hand. Keeping distance when someone is sick also helps. No vaccine yet, but good hygiene is your superhero shield. Think of it like brushing teeth. You do it daily to prevent bigger problems later. What's new in science? Researchers are working hard to beat strep better. Recently, scientists have been studying a possible vaccine for Group A strep, the germ behind scarlet fever. Trials are happening, and early results look hopeful. Another cool thing: faster, more accurate throat tests using smart technology, so you know in minutes. Also, doctors now better understand how the toxin causes the rash, helping create targeted treatments. So while scarlet fever isn't gone, science is gearing up to make it much rarer in the future, maybe even a